Good afternoon, and thank you for inviting us here today. My name is Micah, and I'm joined by my colleagues Michelle, Vivien, and Alex as part of Ontario's Ministry of Health Working Group. Today, we will be exploring Canada's ongoing long-term care crisis, which has recently been amplified by the COVID-19 pandemic. Slide, please. Here is a brief overview of our presentation today. First, we'll be discussing the background of the issue. Second, the policy objectives. Third, the policy options. Fourth, the implementation plan. And lastly, concluding remarks. Slide, please. To begin, Canada's long-term care, herein referred to as LTC, has been especially hard hit by the COVID-19 pandemic. The average amount of COVID-19 related deaths in LTC homes among the OECD countries is 38%. In comparison, Canada is sitting at 81%. Canada's failure to protect its most vulnerable from the virus has prompted outcry from coast to coast. In response, the federal government has announced its intentions to develop a national standard for LTC in Canada. Furthermore, within Canada, Ontario has been at the epicenter of the LTC crisis. There have been over 21,000 cases of COVID-19 in LTC, which have resulted in 3,730 resident deaths as of yesterday and 11 staff deaths. Without significant initiatives to address the systemic issues, these problems are only going to get worse. Slide, please. Ontario has recognized the magnitude of the crisis within the LTC homes. On the left, you can see that the province has taken many steps to stabilize and improve the situation. In addition to these actions, on the right, you will find some examples of Ontario that has committed funding to a variety of programs, especially infrastructure, to help relieve the LTC crisis. Slide, please. In essence, at the core of Canada's LTC crisis is the stark reality that there are not enough beds available for the aging demographic. Canada's senior population is expected to grow by 53% by 2041, and Ontario's population will follow a similar trend. And if you look at the graph on your right, you can see that Ontario's LTC waitlist has been consistently increasing, with over 30,007 people waiting for a bed today. Ontario's recent investment in LTC infrastructure is essential. However, in order to protect its most vulnerable, more action must be undertaken in the short term. Slide, please. As a result, the LTC issue in Canada is at a critical point. It requires immediate and sustained actions from all levels of government moving forward. The problem we are here to address today is that the province must decide the extent in terms of their collaboration with the federal government and other provinces on national standards, and develop policy options to address the critical shortage of care in Ontario. I will now invite my colleague, Michelle, to further elaborate on the matter.
Slide, please. The federal government's intention to develop a national standard for LTC has resulted in a very positive response from Canadians. Most importantly, if you direct your attention to the left, evidence has shown that 90% of Canadians are in support of a national standard. Furthermore, several associations have publicly voiced their support. Developing national LTC standards will also result in benefits for Ontario. For instance, it would help LTC facilities attract and retain qualified staff, provide access to standardized data collection to better assess facilities in terms of health and safety, as well as improve the standard of quality of care. Altogether, developing national standards would emphasize patient and family-centered, accessible, accountable, and sustainable care. Next slide, please. The LTC crisis is substantial, and it cannot be addressed by Ontario alone. Therefore, we recommend that Ontario engage in a partnership with the federal government to develop national standards, not federally imposed LTC standards, in return for federal funding and collaboration. We advise the Ontario government to offer a memorandum of understanding to develop national standards over 2 years, with a transitional framework of 3 to 5 years for implementation. In this partnership, the province should expect the federal government to assist and provide investments for the implementation of the national standards. The Ontario government should expect the federal investment to range between $500 million to $1 billion, with a 60-40 federal to provincial ratio. Slide, please. Within the federal-provincial partnership, our working group proposes 2 policy options that Ontario can pursue to address the LTC supply crisis. Both policy option addresses Ontario's LTC supply and will serve as critical points of negotiation in the federal and provincial partnership. Slide, please. The following policy objectives will be used to assess the policy options based on their ability to address critical components of the LTC supply in Ontario. Altogether, the recommended policy should be effective, cost-efficient, and publicly supported. I will now invite my colleague Alex to present the first policy option. Slide, please.
Thank you. The first policy option is to improve public health infrastructure. This involves working with the federal government to increase the number of LTC beds in the province. The advantage of this approach is that it allows us to help close the long-term infrastructure gap and reduce the wait list of current and future seniors waiting for access to care, which, as mentioned earlier, is projected to increase substantively going forward. The disadvantage of this approach is, as already mentioned, the Government of Ontario has already invested significant funds into infrastructure, and further investment will be costly for both levels of government with marginal benefit, and is not expected to make an impact within 5 to 10 years. Slide, please. Within this policy option, we have provided 2 key programs that the Ontario government could pursue: the establishment of a facility rating system for LTC homes, and a renewed investment in LTC to create more beds. Firstly, a facility rating system would take established data sets from Health Quality Ontario, along with inspections currently undertaken by the Ministry of Health and Long-Term Care, to generate ratings that are accessible to the public and updated on an annual basis. This program would be expected to cost between $1 to $5 million a year, with a planned implementation timeframe of 2 years. The purpose of this program is to allow seniors transparency of choice when choosing a facility, and would pressure existing LTC operators to improve their standard of care in response to market forces. Next, additional investments are recommended to create new LTC beds to close the infrastructure supply gap, which has not been fully addressed by the Ministry of Health's existing investment plan by 2024. This new program would expand the existing investment from 2024 to 2030 with an additional price tag of $1.75 billion for an additional 15,000 beds. Slide, please. With respect to federal action, we suggest that Ontario requests that the federal government create a public health stream in the currently underutilized Infrastructure Bank of Canada to provide LTC funding to address supply issues. We would anticipate federal investment of close to $10 billion to the provinces over a 5-year period. Next, my colleague Vivien will present our second policy option for your consideration. Slide, please.
Thank you, Alex. Our second policy option, Aging in Place, focuses on an element of LTCs that has been under-examined in the Canadian context, and in fact presents several opportunities to increase the supply of LTC beds and simultaneously reduce demand. For the Ontario government, funding for a patient costs $150 per day in long-term care, compared to only $40 per day if the patient was using home care. In other words, it costs the province nearly 4 times more to fund a patient in long-term care than home care. Remarkably, recent polls indicate that 85% of Canadians would prefer to age in place in their homes and communities. Of course, aging in place must be implemented well or otherwise result in disadvantages, in costs with unrealized benefits to the province, as well as unforeseen home upkeep and mobility challenges for seniors in their home. Slide, please. To implement and promote aging in place in Ontario, we have identified 4 key areas of action. First, we propose that Ontario reform existing caregiver and disability tax credits to make it more financially feasible to pursue aging at home. Improvements would involve redesigning the Ontario caregiver benefit after the model currently in place in Nova Scotia. Next, we advise that the province consult with the Ontario Personal Support Workers Association. As it stands, the turnover rate in personal support workers is 25% annually. Professionalization to achieve living wages, training, and career development will reduce labor shortages and excessive turnover in this industry, and improve care to seniors aging in place and aging in LTC facilities. Third, we recognize that aging in place requires technology enablement. The province has already begun investing in these technologies, but we anticipate a need for additional investments to strengthen accessibility in Ontario's remote communities immediately. Finally, the decision and ability to age in place can be overwhelming. To this end, we propose that the Ontario government introduce and implement an aging-friendly home audit service. This program would be similar to the Home Efficiency Rebate Program, wherein eligibility and access first require an at-home assessment conducted by qualified professionals who visit your home and assess your needs, and then provide a set of recommendations. Slide, please. While the province can begin implementing many aging-in-place strategies immediately and independently, it would benefit from federal action in the following areas. First, we advise that the province request federal government action to match reforming disability and caregiver tax credits to improve access and incentives to age in place. Notably, the non-refundable nature of current federal tax credits places undue burden and ineffective incentive on caregivers, and especially female caregivers. The province could advise the federal government to approach reform in this area with a GBA plus lens. Next, we advise the province to request federal action to expand the international mobility program to include personal support workers. This would expedite the entry of foreign nationals willing to work to take care of our seniors and address immediate labor shortages in this area. Thirdly, we suggest that Ontario request the federal government to continue investing in the research and development of smart home technologies. These technologies translate to direct benefits for seniors and caregivers in aging in place. Finally, in addition to the administrative expansion of the International Mobility Program, the province could request federal action to create a permanent immigration stream to add to the supply of personal support workers across the country. Next, my colleague Micah will present our formal policy comparison for your consideration. Slide, please.
Thank you, Vivien. It is evident that the supply of LTC beds in Ontario and Canada must be a top priority for both governments moving forward. However, solely funding the creation of more LTC beds would not be a cost-efficient option for the Government of Ontario. Similarly, the construction of LTC facilities is a lengthy process that Ontario has already committed to without further immediate impact. And lastly, since public health infrastructure is a long-term solution to the current short-term crisis, public support will be weak. Ontarians are looking for fast action. Aging in place is a cost-efficient solution that would provide immediate relief for Ontario's LTC supply shortage, which, in return, would also result in strong public support. It is for these reasons that option 2, aging in place, is what we recommend Ontario bring to the negotiation table with the federal government and other provinces as a solution that best meets the province's immediate needs. While efforts to improve health infrastructure in the short term will do little to address LTC supply, aging in place will help alleviate the supply pressures of the LTC sector that they are facing right now, as well as simultaneously helping to diminish demand for LTC in the long term. Slide, please. More specifically, the federal government should invest $500 million to $1 billion to support the implementation of national standards across Canada. Since Ontario is home to approximately half of Canada's senior demographic, the province should receive up to $500 million in order to put the national standards into practice across the province. In addition, Ontario should request that the federal government invest up to $1.1 billion over the next 5 years to support the Age in Place strategy in Ontario. With this help from the federal government, Ontario will contribute up to $1.1 billion over the next 2 years to implement the province-wide Age in Place strategy. Last, it is important to note that in the long term, we do urge both the federal and provincial government to consider strategically investing in LTC infrastructure in order to meet increasing demand. Slide, please. Negotiating with the federal government will require strategic planning. Ontario is well suited to play a leading role in establishing partnerships. We recommend that Ontario consult with like-minded provinces to identify and implement best practices to age in place and increase the supply of LTC spaces. Similarly, Ontario should also seek to collaborate with groups invested in age-in-place strategies. For instance, the Federation of Canadian Municipalities, who is the national voice of the municipal government, actively supports aging in place as a priority for addressing Canada's LTC crisis in communities. I will now invite my colleague Alex to discuss the risk mitigation strategy for the proposed Aging in Place initiative. Slide, please.
We have identified three key potential risks to the aging in place policy. The first risk is that of public expectation. Due to negative media coverage over the LTC crisis, public frustration over this issue is high. We anticipate a medium likelihood of public criticism regardless of policy adoption. To mitigate this risk, we propose Ontario set clear and careful expectations in their communication strategy, while also including achievable target goals to demonstrate tangible process in addressing the LTC issue. The second risk is that of a stalemate in negotiations between federal and provincial governments. Due to different priorities between the two levels of governments over this issue, we expect a medium likelihood of stalled progress in the implementation of federal policies. We suggest that Ontario align with other provinces on issues of shared interest, such as Manitoba, Quebec, and Nova Scotia, who are interested in prioritizing aging in place policies in order to leverage a better negotiating position with the federal government. Finally, the issue of fiscal deficits will be the greatest threat to any policy addressing the LTC crisis. With current provincial deficits at $34 billion and a federal deficit of $381 billion, and as well as likelihood of increasing and ongoing deficits, we anticipate little appetite for further long-term spending. To mitigate this, Ontario's policy should emphasize how adoption of aging in place strategies reduce long-term health costs on healthcare budgets, illustrate the revenue-neutral approach through administrative and regulatory savings, as well as highlight the essential need to reassure Canadians of their future aging prospects in Ontario. Now back to my colleague Michelle, who will discuss our implementation timeline and communication strategy. Slide, please.
Thanks, Alex. Ontario should expect the implementation programs under provincial and federal leadership to coordinate within similar timelines. In 2021, Ontario will engage in negotiations with the federal government to develop national standards. Simultaneously, the province will increase capacity for telehealth and telemonitoring, as well as pursue the professionalizations of PSWs. By 2022, both Ontario and the federal government will have introduced a reformed caregiver benefit and disability credit, and Ontario will pursue the implementation of age-friendly home audits. By 2024, negotiations will have concluded and the national standards for LTC will be introduced. The standards will undergo a 2-year implementation period, followed by a thorough evaluation to assess the effectiveness in 2026. Similarly, investments in research and development of smart technology, as well as permanent immigration streams with PSW home care criterion will be fully implemented by 2026. Slide, please. Next, we advise the Ontario government to adopt a strong communication program that will target 4 key stakeholders: the general public, the aging population, the federal and provincial government, and potential provincial partners. The key message for the public audience is that the province is committed in supporting Ontario's senior population. Furthermore, messaging between the federal government will highlight how Ontario has responded in good faith to the federal offer for a national LTC strategy. Overall, aging in place will be communicated as a strong initiative that responds to the urgent needs of Ontario seniors. I will now invite my colleague Vivien to provide our closing remarks. Slide, please.
In summary, we recommend the Ontario government partner with the federal government to help develop national standards for long-term care in exchange for suitable federal investment. The severity and complexity of the issues in long-term care are clear, and the crisis is fundamentally a national problem that would benefit from national collaboration. On a provincial level, investing in building more long-term care facilities cannot be the only solution to delivering quality healthcare to seniors in Ontario. Seniors in Ontario have spoken. The province should therefore continue investments in necessary long-term care infrastructure while assigning appropriate and immediate attention to enabling seniors to age in place and give our seniors a real opportunity to grow old in the comfort of their own home and community. Slide, please. At the end of a long journey, we often think wistfully of the comforts of home. All Ontarians deserve to age well and happily at home. Thank you.
Well, team, thank you very much for a very good presentation. The members of the panel do have some questions for you, and I just want to see if I've got any hands up yet. I'll start off the questioning then. I've just got one. Your aging in place strategy seems to assume that you can address the long-term care home problem simply by getting more people to age in place. But what evidence do you have of that? I mean, won't there always be a need for facilities to meet the needs of people who simply can't be cared for anymore at home for whatever reason? There's my question.
We definitely agree that we will have a continued need for long-term care infrastructure, and that's why we propose that we continue to invest in creating more beds in long-term care. At the same time, we have found reports indicating that up to 20% of residents of long-term care facilities at the moment could have aged at home, and that's the area that we want to address with the aging in place strategy.
Okay, thank you, Vivien. So I'll go to Susie McDonald, then Renelle, and then Andre. Susie.
Thanks very much for the presentation. I'm struggling a little bit with the costing that you've laid out. So I think, as I understand it, under your option 2, there would be the federal action cost as you've laid those out. And then in addition to that, there would be a cost specific to negotiating and or to implementing the national standard. And if I've got that right, then my question is, in that national standard, are you looking for a transfer for that amount? Is that a per capita amount, an age adjusted amount? What would be encompassed in that?
I believe it would be a lump sum amount delivered to the province. We have anticipated this cost based on the original mental health work standards that were developed in 2012. So we looked over the cost and found that it cost the federal government an equivalent amount. And so if Ontario were to collaborate in implementing these standards, we would want a portion of the funding. And so since we consist of 50% of the demographic, we would ask for 50% of that funding.
Okay, Renelle.
Thank you for that. And I sort of have a little bit of a follow-up question around that. So I appreciate you noting some of our like-minded PTs with respect to the age in place strategy, and just wondering your assessment that you've done, and perhaps you can just help inform us a little bit more. Would we find that same like-mindedness with respect to developing national LTC standards in terms of building those partnerships with some of our PT jurisdictions?
Who wants to answer that one?
Generally put, we believe that the provinces have indicated generally that while they may be open to the concept of national standards, we are not comfortable with any federal intrusion through any amendment through the Federal Health Act. So Quebec has indicated that they would be receptive to federal funding, but not while respecting provincial jurisdiction. So in that sense, we feel that we could definitely have partnership with provincial territorial governments.
Okay, Andre Fortier.
Yes, thank you, Jim. Thanks for the presentation. Just to follow on that, just maybe a little more precise, what makes you think that Quebec would follow you or other provinces that are not interested in national standards in that perspective? It's one thing to say that people are interested or provinces or government interested in additional federal funding, but to say that they will agree to national standards as you propose, that's another issue.
As we have illustrated earlier, national standards are not federal standards. All the premiers have indicated an opposition to federally imposed standards. That does not mean that we do not understand that we have senior healthcare needs. We do not necessarily propose these standards are voluntary. is our anticipation, similar to the mental health standards that were developed in 2012, when we can't speak specifically to the position of other provinces, the results for the mental health strategy standards demonstrate that they did experience widespread adoption by the provinces because they were voluntary and that they had input from the provinces.
So you think that the federal should not make mandatory standards? There was some kind of leeway to the provinces with the funding. Do I understand right?
I believe that was made clear during our presentation that we were looking for national, not federally imposed standards. So national standards imply respecting provincial authority, cooperative federalism, and most importantly, a volunteering aspect rather than an imposed legal aspect.
Can I just do a quick follow up there? But just to reinforce my colleague's point, I mean, in a sense, either you have national standards, as you've said, not federal ones, but that if they're going to be national standards, they have to have some meaning. You can't just say that you've got a national standard and then walk away from it. How do you convince us that you can get to a national standard, a provincially agreed national standard? That would be my quick follow-up.
We appreciate the concerns surrounding the national standard adoption. Our position is that Ontario should pursue participating in developing the national standards. And as to the positions of the other provinces, we can't speak to what they certainly will or will not do, but we do believe that on a national perspective and for the residents of Ontario, participating in this national initiative will contribute to the well-being of our citizens.
Okay, thank you, Vivien. Steve Orsini, next question to you.
Yes, thank you. I appreciate the presentation and the responses to the questions. So mine just follows on this pan-Canadian standards that are developed by provinces. Have you sort of related the amount of money needed to tie into with the standards that, even if they're voluntary, they raise expectations that the public would expect provinces to follow? So is there a correlation? You know, obviously, the higher the standards, the more comprehensive, the more money that will be needed to meet those standards.
Team, what do you think? Who wants to answer that one?
Sorry.
So we have, sorry, go ahead, Micah.
Sorry. Could I ask, could you clarify a little bit? Sorry, I don't think I grasped the entirety of your question.
No problem at all. I'll be more articulate this time. So if you look at, let's say there's standards, whether it's 4 hours per day on average for a long-term care resident, or 5 hours, or you get treated by a registered nurse every so often. Whatever those standards are, it's going to have a price tag associated with that. So is your funding to meet those standards, even on a voluntary basis, is it correlated? Obviously, the higher the standards, the more resources one would think they would need to meet those standards. So I'm just trying to think how you costed out your funding needs relative to standards that may evolve over time.
Yes, absolutely. Thank you for the clarification on that matter. So we did give, for that reason, as you mentioned, it can evolve. The standards might, the cost is not certain until we implement it. And that's why we gave a range between 500 million to 1 billion. It will depend on the province and on the standards that are negotiated between and that get developed in this partnership. We did find that it cost $1.9 billion to increase from 2.7 hours of care to 4.1 hours of care. So we did take that into consideration. That's an annual cost. But in total, for this funding, that the funding that we are looking, that Ontario is looking to get from the federal government to implement the national standards, we're looking for a 60-40 split to help with those implementation costs. I hope that answered some of your question.